Our next session is about infection prevention and control assessment framework at the facility level. This is one of the tools that is very, very useful, and this is one of the tools that can be used for at two levels of the IPC cycle. If you remember the IPC cycle that we talked of earlier, it had 5 steps. The first step was to plan. The second step was to have a baseline assessment. The third one was about action, and the fourth one was about assessing the impact. So this tool can be used for step 2, which is having a baseline level, and also for step 4, which is an assessment. And because this is a structured format, and it is basically meant as a self-administered questionnaire, you can use this tool to have a baseline of any healthcare facility. And being familiarized with this, please make sure that this is going to be one of your assignments as well, that you have to fill in this form for your workplace. So please pay attention to what the different areas of this tool are. And again, this tool is freely available on the website, so you don't need to worry about where to access it from. So basically, what is it? The infection control program assessment framework is in short also called IPCAF. So what is IPCAF? IPCAF is a tool to support the implementation of the WHO guidelines on core components of IPC at the healthcare facility level. So you have to see where the facility stands as far as IPC is concerned, which is the baseline, and you can also see how far it has come, which is assessing the impact. So you can use this tool for both. Ideally, if you can use it for baseline and then use the same for impact, you can have a comparison of the same. It's a systematic tool that can provide a baseline assessment of the IPC program and activities within the healthcare facility, as well as the ongoing evaluations through repeated administration. So the thing is, please remember that this tool ideally should not be used for comparison of two facilities. You shouldn't, but within one facility you can use it today, and then you can use it like a month later or a year later, and then the today's results you can use as a baseline, and then later on you can use these results as the year down the line. You can use those results and use this baseline for comparison to see how far you have gone. So this tool can document progress over time, and it can also facilitate improvement. It is a structured, closed formatted questionnaire. I'm going to show it to you in a minute. So by closed formatted, I mean all the options for answers are already there. So it can easily be filled. It's like a checklist. So it can easily be filled because the answers are already there. It doesn't have any open-ended questions. It's all closed-ended. The other thing is that it is primarily intended for self-administration. So you can give it to the facility people, and the facility people can administer it to themselves. But ideally, it's used for joint assessments. Like it needs discussion to be able to be filled. So more than one people are involved in filling it, and external assessors along with the facility staff, they can both sit down together and get hold of this tool. What is the purpose of this tool? I've discussed this earlier, but it's important to know that it is a validated assessment tool. So why do I say validated? Because it has been used earlier on, and it has been produced by experts. So we don't have to put in the same effort again, because somebody did it for us. So it's a validated tool. The only thing we need to do is we need to be truthful while filling it. So sometimes we try to put our best face forwards, and we try to put all the positives there. So that shouldn't be the case. Whatever the reality is, whatever the things are showing, we need to put that in. It's a validated assessment tool designed to measure the IPC situation of a healthcare facility and determine the core components already in place and identify the gaps. So that's what it does basically. What is the situation at the moment that you're administering this tool? How is it structured? I said it earlier as well, it is a closed formatted questionnaire, and there's a scoring system as well. So you have to remember, it's the analysis of the information that you get from it is also easy. Why is it easy? Because there's a score at the end, and once you score, then you're able to know where you stand or where your facility stands. So in all the 8 components, it gives you a scoring, and then you can find out the gaps and you can find out where you stand also. It's important to remember who will complete it. It should be completed by healthcare professionals themselves, and ideally healthcare professionals who are responsible for the IPC measures and who have in-depth knowledge of IPC, because there are certain terms that if they're not understandable, then the information that is being provided can be different than what the actual situation is, and then that can create a problem or a hurdle. It can also be used for joint assessments with external and internal stakeholders as well as external stakeholders. They can both sit together and then they can fill it together as well. That's something that is there. Coming to the instrument, like I said, it is freely available at the website. So anybody who, if you have small amount of searching skills, you can search it up. I've put the title page as a picture in the presentation for that reason, that if you click on anything other than this, then don't open that. But if this page is there, an orange page with the world map and infection prevention and control assessment framework at facility level name, then that's the actual thing. If you go through it, I would like to go through it with you together once, so that if you're filling it or if you're helping somebody else fill it for the facility, then it becomes easier for you. So we have looked at the purpose. It has the purpose and who should complete it there as well. So there are details that if you want, you can go through it. How is it structured is, from the scoring you can find out if the situation is inadequate, if the situation at your facility is basic, or if it is intermediate, or if it is advanced. So it is structured in such a way that you can actually know where you stand. And as far as the interfacility comparison is concerned, we are very keen on comparing facilities. How does my facility compare with the other facility? But this tool is ideally not meant for comparing facilities. It is meant for self-improvement. So you can do it for your own facility, and then you can do it at a later date for the same facility, and then then you can measure your own progress. But you cannot compare. Ideally, you shouldn't compare 2 facilities using the same tool. Going through this, if you go to the second page, it starts off with the core component, the first core component, which is the infection prevention and control program. So that is the first question that is being asked is, do you have an IPC program? So if, for example, assume that I am the person who is filling this up for my facility. And what is it? Do you have an IPC program? Look at the answers. So the answer is no. It might be possible that my facility does not have an IPC program, or it could be that it's yes without a clearly defined objectives. So it's there on paper, but it's not complete. And the third situation could be yes with clearly defined objectives and annual activity plan. So it gives you a direction also on what is the ideal thing that should be done. The second is the IPC program supported by an IPC team? Again, closed-ended. Does the IPC team have at least one full-time IPC professional or equivalent? Again, the answers are there and you can tick the relevant box. Does the IPC team or focal person have dedicated time for IPC activities? It happens that the person is there, but the person does not have any dedicated time. And trust me, it has happened often enough. Does the IPC team include both doctors and nurses? That's an oversight that needs to be acknowledged also. Sometimes we think that these things come only in the purview of doctors. That's not the case. Doctors and nurses and other paramedical staff, they are all important stakeholders, and their involvement in the program means that their interests are also safeguarded and they can work as a team. The question number 6 is, do you have do you have an IPC committee actively supporting the IPC team? So the committee is different from the team, right? So if there's a yes or no, whatever the reason, ideally it should be a yes. So if you see all the answers, the bottom one scores the highest. So that's ideally what should be there. So if it's a yes, you score 10. If it's a no, you score 0. And for some variables, there is an intermediate numbering as well. Then do you have number 7 is, are any of the following professional groups represented or included in the IPC committee? So senior, this gives a list of people, right? And if you see this, the scoring is not from 0 to 1, the scoring is from it could be 0, it could be 5, it could be 2.5 as well for this section. And why is that? Because they have defined, if you are up to the mark, then it's full. If you are somewhere in the middle, then the scoring shows that. The next is, do you have clearly defined IPC objectives, specific critical areas? And this again has a grading that you need to see. Does the senior faculty leadership show clear commitment and support for the IPC? Again, it has the maximum you can get. This one is 5. And the last one is, does your facility have microbiological laboratory support, either present on or off site for routine or day-to-day use? It is so important that the marking is from 0 to 10 in this case, right? So that's something that you need to see. So the subtotal score. Why is it a subtotal score? Because it's being scored from out of 100, but it is for one component only. So that's why it is called a subtotal score. So with this, we complete the first component. Coming to the second component. Second component is infection prevention and control guidelines. So some of the questions have subdivisions. The first one is, does your facility have the expertise in IPC for developing or adapting the guidelines? The score is 7.5. Does your facility have guidelines available for all these details? So they have all. If you have everything, then you score 2.5. If you don't, then you might score 0 as well. Depends on what you have. Are the guidelines in your facility consistent with the national international guidelines? Is the implementation of the guidelines adapted? Are frontline healthcare workers involved in both planning and executing the implementation of IPC guidelines? Are relevant stakeholders, for example, health managers, doctors, quality management staff, involved in the development and adaptation of the IPC guidelines? Do healthcare workers receive special training, and do you regularly monitor the implementation of at least some of the IPC guidelines in your facility? So if, like I said, if all this is yes, then you can score a 10 or a 7.5, the highest. If it is not, then you might as well score a 0. Again, the subtotal is from 100, but why is it a subtotal? Because it is one component only. Coming to the third component, the third component is infection prevention, education and training. So within this, there are certain questions. I won't go into those questions in very much detail, but there are certain questions. The subtotal would be from 100, but the questions are different and the sub questions are different as well. For example, the first one is, are the personnel with the IPC expertise, are there persons there to lead the IPC training? If they are, then it's a 10. If they are not, then it's a 0. Are these additional non-IPC personnel with adequate skills to serve as trainers and mentors? So you have to choose the answer. How frequently do healthcare workers receive training regarding IPC in your facility? How frequently do cleaners and other professional faculty involved in patient care receive training regarding IPC? These are so important, and for those of us who have been through the COVID-19 epidemic, you would understand how important these things are. Does administration and managerial staff receive general training? So it's important. Sometimes we think that only the healthcare workers or people directly at the point of care are the ones who should be trained. But like we have said earlier, if the policymakers are not trained, they would not invest in this specialty at all. How are healthcare workers and other professionals trained? So it's not that they are training is important, but how are they trained, right? And then there are the periodic evaluations of effectiveness of training programs. So once they are trained, are they evaluated as well? And in IPC, is IPC training integrated in the rest of the training programs, right? So all these things are very important. And for specific IPC training of for patients or family members, if there's something that is going on, and is ongoing development education offered to IPC staff, for example, regularly attending conferences and courses. So again, the subtotal is from 100 and depends on what the facility would score. The fourth one is healthcare associated infections. These again have different kinds of priorities and different kinds of questions. And for example, in question number 6, you can see that is your facility surveillance is conducted for different kinds. So you can understand that these 6 or 7 subcomponents of surveillance are there. So surveillance is an all-encompassing thing. It's not that you only have to have surveillance at the surgical unit and not at the medical unit. That's why they have these sub-important sites on which the surveillance should be there. And if it's a yes, then you score. If it's a no, you don't score. Do you regularly evaluate if your surveillance is in line with the current needs and priorities of your facility? That's also very important. Sometimes we are so focused on the international things that we do not care about the rest, about what's going. We close our eyes to what's going on around us, and that's something that we should not do. Again, this sub scoring, the method of surveillance, and the information analysis. This also has a feedback. If you see the last question of surveillance, it says how do you feedback up-to-date surveillance information, and this is so important that it should be done at least annually, right? So how do you do it? That also carries a score, and the subtotal score again is 100. Coming to the fifth one, which is multimodal strategies, you have to the healthcare facility person has to say whether the multimodal strategies are there or not, or whether the multimodal strategies, what kind of multimodal strategies. If you remember, we have done at an earlier session that there are 5 different ways of having multimodal strategies. So all those are listed here in case one or the other, none of them is missed, and then there's a different score for those as well. The score is graded, so it's from 0 to 10, but there's a score for 5 as well, and the subtotal score is again 100. The sixth component is monitoring, audit, and IPC practices and feedback. So this also has different kinds of questions. Important thing is that the feedback, not only is the audit required, but the feedback is very much importance. And even the reporting of monitoring data, as you can see in question number 6, carries 10 marks. So it depends on what you are doing, and that would give you. The last 2 core components are the core component number 7 and core component number 8, and you know and I know that these 2 are basically for the facility level, and they relate to the workplace environment. The first one is the workload, staffing, and bed occupancy. For this, for staffing and bed occupancy, the questions are different and they are graded as well, and depends on what the situation is. The person can fill this up and get a score of this subtotal score from about 100. The last one is the core component, and the core component includes the built environment, the materials, and the equipment for IPC at the facility level. So what are the different things that should be there? Water is a core and essential component. So are the water services available at all times of in sufficient quantity for all uses? For example, hand washing, drinking, personal hygiene, medical activities, sterilization. It also shows how the need of water for IPC activities. So it has a graded scoring from 0 to 7.5, and depending on what the situation is, that can be done. And the important thing is there a reliable and safe drinking water station and accessible for staff, patients and families at all times and in all wards and locations? Having worked in different situations, I think that's a tall order, and I think not all healthcare facilities have this access to for everyone to safe drinking water. The next is hand hygiene and sanitation facilities, and they are functioning hand hygiene situations, that is alcohol based hand rub solution or soap and water and clean used towels available in all points of care, and the use of sanitation facilities as well. There is power supply and ventilation and cleaning are also very much part of it. Without that, you cannot expect the IPC things to happen. So the last of all is the patient placement and personal protective equipment in the healthcare settings, whether they are available or not. Medical waste management and sewage, what are the procedures for management of that. Decontamination and sterilization, which is a very core important part of this. So once you have finished this, I expect you to do that as an assignment as well. So you need to go back and you need to fill in this form at your place of posting. So how would you interpret this? Once you have done it, how would you interpret it? It's a 3-step process. So the first thing is you add up your points, very easy. So you have points, you add up your points, right? For each sub score. So there are 8 core components, so you would have 8 scores, right? 8 scores out of 100, and when you add them up, you would have a score out of 800. The second one is you determine the assigned IPC level. So where do you stand from total score? And as far as the total score is concerned, if your total score out of 800 is 200 or less, this means it's inadequate. If it's between 200 and 400, it's very basic. Between 400 and 600, it's intermediate, and between 600 and 800, it is advanced. So with this in mind, you review the framework results and develop an action plan. Now that you have everything on paper, this would help you to find out your gaps, your major gaps, what can you do to rectify your gaps, so that a month down the line or a year down the line, when you fill the same questionnaire, you can jump from one to another. You can go from inadequate to basic, or from basic to intermediate, or intermediate to advanced, or maybe you're good enough to go directly to the advanced level, which is hard but not undoable. So this was all about the IPCAF. The last slide of this module for basics of infection prevention and control. This is the last slide, and it tells you about your home assignment. So your home assignment is that you have to administer this IPCAF tool that I have explained to you in the last few minutes, and at your health facility. For those of you who are not working at a health facility, you can choose a health facility and you can go there, ask permission, and go through the questions one by one. And you have 15 days for this activity, right? And then you prepare a 3-minute video about what you found out using that IPCAF, how was your experience, and then you upload it at the given link along with the completed IPCAF tool. And this video will be peer reviewed as well. The second class assignment is you have to make roles and responsibilities for an IPC team. So you have to imagine that you are in a position to compose an IPC team, and you have to tell them what needs to be done as well. So based on what we have gone through right now, and based on whatever you can find as evidence on your search of the internet. I've added one journal article in that case, but you can have any more as long as you reference it. So the references, there are other references available in Google Scholar also. So with this, I finished this module. Thank you very much for your patience, and I'm very pleased that you chose to take this module. I'm sure this would take you a long way, and it would benefit you as well as the community in which you work on. Thank you very much.